Welcome to the Bozeman Health Sleep Disorder Center. My name is Merle Phipps. I'm a registered respiratory therapist and registered polysomnography technologist. I'm the Sleep Center Manager here at Bozeman Health Sleep Center, and I would like to take this opportunity to explain the process that you are about to undergo. You are here tonight to undergo a sleep test. This study is also known as a polysomnogram. Sleep studies are used to investigate complaints of daytime sleepiness, non-restorative sleep, snoring, insomnia, and other sleep-related complaints. Our sleep center is staffed with registered polysomnographic technologists and respiratory therapists, and we are accredited by the American Academy of Sleep Medicine. When you arrive for your sleep study, you will be greeted by one of our technologists and shown to your room. It is our goal to make you as comfortable as possible during your sleep study. Each of our rooms are designed to feel like a welcoming room in your own home. We have sleep number adjustable beds, TV, Wi-Fi, and private bathrooms with showers to help you relax. When you come for your sleep test, you should bring anything you need to be comfortable during your stay with us. It is important to remember that the Sleep Disorder Center does not dispense any medications. The optimal style pajamas are a two-piece set with a top and bottom. The pants will help to contain the leads that are attached to your legs. Silk and satin fabrics and nightgowns should be left at home. You are encouraged to avoid napping or consuming caffeine the day of your study. These might interfere with your ability to sleep in the center the night of your test. After you arrive at the sleep center, are checked in, and have made yourself familiar with your bedroom, we will begin what is called the hookup. During the hookup, the sleep technologist will attach many wires, electrodes, and bands to your body. It is important that you understand that this process is painless. This equipment allows us to record your sleep, and the hookup process takes about 45 minutes. The first group of electrodes are placed on your scalp. Because the position of these electrodes is very important, the technologist will measure your head and mark it for electrode placement. Once identified, these positions will be cleaned with a substance that will allow maximal transmission of signals from your body to our computer. Electrodes are then placed by your eyes to monitor eye movement and on the chin to monitor muscle tone. All of these electrodes help give us a better picture of your sleep. A sensor with a bright red light is placed on one of your fingers. This measures the amount of oxygen in your blood. Nail polish will interfere with this measurement, so it is necessary to remove the polish from at least one finger. Finally, a sensor that is similar to one used to deliver oxygen is placed in your nose. This sensor measures the airflow coming from your mouth and nose. You may wonder how you might possibly sleep with all the wires in place. Relax. Most people sleep just fine after the hookup is complete. You are encouraged to sleep in whatever position is comfortable for you. Keep in mind that we may like to see some time on your back. The technologist may come in and ask you to try and sleep on your back if you haven't done so naturally. Occasionally, an electrode may come loose during the night. If that happens, the technologist will come in and reattach it. All of the electrodes are connected to the computer in the control room. Each room has a camera to monitor your movement and body positions while you sleep. The rooms also have a microphone which allows us to communicate with you as the test progresses. During the night, the sleep technologist will monitor the video and information from the electrodes. Depending on the results we begin to see, you may be awakened during the night so that the technologist can initiate CPAP therapy. You may be familiar with the term obstructive sleep apnea. Obstructive sleep apnea is a disorder in which a patient's upper airway, including palate or tongue, collapse into the airway, preventing a patient from breathing normally. CPAP is short for continuous positive airway pressure. CPAP is used to treat obstructive sleep apnea. If you do not receive CPAP therapy during your study, it doesn't necessarily mean you don't have sleep apnea. Your ordering provider will discuss the results of the sleep study, describe a diagnosis, and help formulate a treatment plan based on your symptoms and the results of your sleep study. In the morning, at the end of the study, The technologist will remove the electrodes and wires. Removal of the electrodes and wires is painless. You may then take a shower, get dressed, and go on with the rest of your day. One of our sleep center physicians personally reviews the entire sleep study to ensure that you get a complete and thorough reading. The results of your sleep study should be ready for your provider within about 2 weeks. We encourage you to make an appointment with your provider to discuss the results of your study and to discuss whether additional diagnostic tests are necessary or how to treat the sleep disorder identified. I would like to wish you good luck during your sleep test. Please relax and let us know if we can make your stay with us more comfortable in any way.